Imagine there is a fire alarm that goes off in your house. Would you switch it off and go back to sleep? That is what most of us do with our headaches. We just ignore it thinking that it is a minor symptom. But what if it is trying to warn you about your brain health or general health? That is what we are discussing today. I'll not tell you to panic over every headache, but some headaches, especially if they are new onset headache, very severe headache, headaches that come during pregnancy, headaches that are associated with fever, neurological symptoms and seizures should not be ignored. If ignored, these can put your life at risk. Well, the most common headache is also called common headache, and that is tension type headache. Most of the people that consult neurologists are actually suffering from this disorder. As high as 50% of world population suffers from this. And this happens due to simple causes like muscle tension, excess screen time, stress and lack of sleep. Most of people think that headache comes from brain, but you know what? Brain does not sense pain. It is the tissues around it that sense pain, and if there is some problem happening in these tissues, that is when headache happens. Say the covering of the brain, blood vessels in the brain or the scalp, muscles around the eyes and neck. These are the tissues that give pain, and if there is any problem in these tissues, one experiences headaches. If there is something wrong with your engine, that is your brain, that tells you signal via headache, and that is when you should pay attention. I'll tell you about 3 patients that I saw last week. Patient number 1, a busy engineer and he's a techie. Obviously he has long screen time and long sitting hours. He develops headaches by evening, and this just turned out to be a tension type headache that feels like a tight band around his head. Patient number 2 is homemaker. She develops headaches, one-sided headaches, and she becomes very irritable during these headaches. She cannot do her day-to-day activities and she also starts to vomit. These happen mainly during menstrual cycle, and that is classical migraine. And patient number 3 is retired army gentleman. He came with severe headache, but he also had imbalance. When we checked, his blood pressure was high, and that was dangerous. That's why we scanned him immediately, and there we found a stroke. Because he came on time, we could pick up the stroke and start treatment immediately. Stress is a very common cause for your headaches. Won't you feel stressed when you have to finish your project on time, or when you are stuck in traffic, you want to reach home fast, or when you have to finish your cooking fast because kids' school bus is waiting? All this day-to-day stress will build up and give you headaches. Number 1 is sleep. If you sleep, all your muscle tension, eye strains will go away. Sleep 7 to 9 hours. Number 2 is hydration. Dehydration causes structural or neurotransmitter changes in the brain, and that will again give you headaches, so hydrate yourself well. Number 3 is stress management. Stress is there every day and in everyone, and you should find ways to handle that stress by finding new hobbies and doing something that makes you feel happier. Rush to hospital if you have this. Very severe sudden headache that is like a thunderclap. It could be brain hemorrhage or ruptured brain aneurysm. Fever, headache and confusion. It could be brain infection like meningitis. Headache during pregnancy. It could be brain clot. Headache that is associated with paralysis, blurring of vision, double vision. It could be stroke. Headache that is new onset, continuous, affecting your day-to-day activities and making you pop painkillers back to back. You should rush to hospital.